Hello everyone, welcome to your online lecture for Anatomy and Physiology 2 covering blood vessels. I will first bring your attention to the term cardiovascular system, cardio referring to the heart, and vas referring to vessels. And today's lecture will be discussing the blood vessels of the cardiovascular system. And between the in-class and online lectures so far, we've focused our attention on the heart structure and its function. And now we're going to turn our attention to the vast network of blood vessels that carry life-sustaining blood to nearly every corner of our body. There are nearly 100,000 kilometers of vessels that are carrying blood throughout your body right now, and these vessels develop through the process of angiogenesis, angio referring to, or angi referring to vessels, and genesis is the formation of, so the formation of blood vessels. This occurs or begins during embryonic development and continues throughout the lifespan. Let me now just introduce you to the different types of blood vessels in their body and what their main role is. Arteries conduct blood away from the heart. That's generally oxygenated, nutrient-rich blood away from the heart to the body's tissues. Capillaries are going to conduct blood through tissues and allow for the exchange of materials. So this is where diffusion takes place at the level of the tissues. Veins do quite the opposite of arteries. They conduct blood toward the heart. Generally, that's deoxygenated blood that also contains waste products so that it can travel to the heart and then to the lungs to be sort of filtered, cleaned, and reoxygenated so that it can be recirculated throughout the body. There are several different types of arteries that are found in the cardiovascular system. The first one we'll begin talking about are elastic arteries. Elastic arteries are also called conducting arteries. They are considered the largest arteries in the body, and they include the aorta and its major branches. Now, as the name implies, elastic arteries are able to stretch without causing injury in order to accommodate the surge of blood that is forced into them when the ventricles contract. They can then recoil as the ventricles relax, so that elastic ability is very important to its function. Muscular arteries are also called distributing arteries. They carry blood further away from the heart to specific organs throughout the body. They are smaller in diameter than elastic arteries are. However, the muscular wall in these vessels is proportionately thicker because it's a muscular wall. It has a thicker wall than does the elastic arteries because it needs that ability to push forcefully blood throughout the body. And if I was to give you a couple of examples of this type of artery, muscular arteries, I would suggest the brachial arteries, the gastric arteries, and the superior mesenteric arteries. These are muscular arteries, just as an example. Now onto arterioles. Arterioles are also called resistance vessels, and they're the smallest arteries. Arterioles are not named individually like a lot of the arteries are in our body, but as a group they're critically important in regulating blood flow throughout the body. They function in a specific way that allows variable contraction of smooth muscle in their walls, which in turn increases resistance to blood flow. So they're either going to contract or relax, which is going to either increase resistance or reduce resistance to blood flow. And it'll help regulate blood pressure as well by determining the quantity of blood that is going to enter a particular organ. So they have quite a bit of control with that. And metarterioles, this is the term used to describe the short connecting vessels that connect a true arteriole with the proximal end of between 20 and 100 capillaries, which will make more sense once you see what metarterioles look like. These metarterioles are important when we discuss nutrient and oxygen diffusion at the level of the tissue, which will be coming up later. In this diagram, it's applicable really to the last slide as well as some of the upcoming slides. But remember, first we have that elastic artery extending off the heart. Blood is going to move into the muscular arteries and be pumped throughout areas of the body. Then as the vessels get smaller, we now have arterioles, and then they get even smaller at the level of metarterioles. And then once they reach the capillary, this is where nutrient and oxygen exchange is going to occur, and then the venules are going to pick up the blood that's been that it contains waste products as well as blood that's deoxygenated, and then once those venules get larger, they become veins returning blood to the heart. But for the purpose of this slide, the arteries are what we're really focusing on. And although we'll discuss the 3 different layers of arteries shortly, I want you to just make note of the elastic artery here. I want you to note the muscle thickness compared to that of the veins. I also want you to note the differences in diameter. You can see that the diameter is larger in a vein, but the muscular wall is what takes up a lot of that diameter in order to forcefully push blood throughout the body. And you can see here, this is at the level of the capillary, and this is a network of capillaries, or a capillary bed here, where oxygen exchange as well as nutrient diffusion is going to occur. On this slide here, you can see the metarterioles. So here we have an arteriole, and branching off the arteriole is a metarteriole, which connects with a variety of different capillaries that are in that area, and then connects to a venule. So if blood is needed in a tissue, so let's say a tissue in this area needs oxygen or different nutrients, then the precapillary sphincters here are going to remain relaxed and considered open. And when this happens, blood is able to leave the metarteriole by these capillary extensions and supply the tissue, and this is where that exchange is going to occur. On the other hand, we have a different situation where the tissue doesn't need nutrients or need oxygen at that time, so blood is sort of shunted through that capillary bed right to the venule, and it's shunted because the precapillary, or it's called precapillary because the sphincters are just before the capillary bed, or before the capillaries. They are closed or contracted, so blood is going to instead remain in the metarteriole and then be shunted to the venule. So talk about capillaries. You'll sometimes hear them, or me refer to them as capillaries or capillaries, but they are microscopic vessels that carry blood from arterioles to venules. So going back to the last slide, you can see that these capillaries carry blood from arterioles to venules. Blood flow through the arterioles, venules, and the capillaries is referred to as our microcirculation. It's an area that can be best seen under microscopic examination to see this blood flow. True capillaries, to this first point here, true capillaries receive blood flowing out of small arterioles. If the precapillary tone is relaxed, then blood will flow into the capillaries, as I already mentioned to you. But if it's high, then very little blood will get into the capillaries. Capillaries are often categorized into 3 groups based on or based on the ease of passage of substance through their walls, or by the structural differences that affect their permeability. It'll make more sense once we speak about them. The first one is continuous capillaries. They have a continuous lining of endothelial cells, so not epithelial, but endothelial cells, with only small openings that we call intercellular clefts, and you can hardly see them here. If you look up close and zoom in, you can see intercellular, so clefts found in between the cells that make up the vessel. And these continuous capillaries are typically found in skeletal muscles, so you should make note of that. Typically found in skeletal muscles, within the lung, and then many types of other connective tissue. The next type is the fenestrated capillaries, and they also have these intercellular clefts between their lining endothelial cells, but in addition to that, so you can see the intercellular cleft here, in addition to that, they also have these small holes or fenestrations through the plasma membrane itself to facilitate exchange functions. So lots of small holes that allow for this, or fenestrations or pores to allow for this exchange. And the last type that we'll talk about is sinusoids. This is the term used to describe the type of capillary that has a much larger lumen and more winding and tortuous courses than other capillary vessels. A couple important points is that the basement membrane of these blood vessels is that normally completely covers the capillaries is either absent in sinusoid capillaries or incomplete. In addition, the fenestrations that are present in the sinusoid capillaries are much larger, and you can see the much larger porous areas. And this results in greater what's called porosity, so it permits the migration of cells in and out of the vessel much easier. Okay, so we just spoke about capillaries. Now we're going to speak about blood vessels and their layers. The walls of both, and we're referring to both arteries and veins, but the walls of both arteries and veins consist of three separate layers, or sometimes they're referred to as coats, called the tunica externa, tunica media, and tunica intima. These layers are arranged in sequence from the outside to the middle and then to the interior, which is the interior is sometimes referred to as the luminal area. So the interior, we're going from the outside to the middle to the interior surface of the blood vessel. And as blood vessels decrease in diameter, the relative thickness of their wall also decreases. Beginning with the outermost layers called the tunica externa, the name literally means outside coat, and sometimes referred to as the tunica adventitia. This layer is made out of a very strong, flexible, fibrous connective tissue. This layer prevents tearing of the vessel walls during body movements because of its strength. Collagen fibers that are present are going to extend outward from this layer in order to connect to nearby structures. So it sort of anchors the vessel in place and also assists with keeping it open. The middle layer is called the tunica media, which is Latin for middle coat. And it's a layer of smooth muscle tissue that's sandwiched with a layer of elastic tissue. So smooth muscle and elastic membrane tissue. The presence of the smooth muscle permits changes in blood vessel diameter. So this muscle can contract or relax and change the diameter of the blood vessel. And the innermost layer is called the tunica intima, the inside coat, and this layer is made up of endothelium that is continuous with the endothelium that lines the heart. The endothelium has a basement membrane on its inner structure to support it. Now, this layer, the tunica intima, is found in all blood vessels. Okay, the tunica intima is a layer that is found in all blood vessels. So that's arteries, veins, and capillaries. But the tunica externa and the tunica media are found only in arteries and veins. And you can go back to this slide here to look at that a little bit closer and look at some of the differences between arteries and veins. Okay? So let's look at some of the components that make up the blood vessel wall. Regardless of how thick a vessel wall might be, there are a few types of material that make up vessels that are very commonly present. The first one to mention is endothelial tissue, or endothelium, and it's a specific type of simple squamous epithelium. You should recall that this type of tissue, a simple squamous epithelial tissue, forms a thin, smooth membrane of flattened cells. Squamous means flat. This tissue is capable of secreting chemicals and is also responsible for reproduction, specifically reproduction of new cells. Secondly, collagen fibers. Collagen fibers that are present in the vascular wall are woven together much like reinforcing strands that are found in a wall of a tire or a hose. Okay, collagen is usually there for strength. Collagen fibers function to keep the lumen of the vessel open so that blood can pass through it, but also to strengthen the wall. So it's strengthening and keeping the vessel walls open and apart. They exhibit some flexibility and stretchability, but it is limited. Elastic fibers, these are composed of an insoluble protein referred to as elastin. And elastin fibers are capable of stretching more than 100% under physiological conditions. These fibers, as you would expect, allow for recoil after distension, like an elastic does. This property of elastic fibers plays a very important role in maintaining what's called passive tension in the vessels of the cardiovascular system. So this type of tension is required to maintain normal blood pressure levels throughout our cardiac cycle. Okay, so passive tension allows for regulation of blood pressure during our cardiac cycle. And lastly, smooth muscle cells that are found in the walls of all segments of the vascular system except for capillaries. So capillaries do not have smooth muscle. You should recall that smooth muscle is involuntary, so we don't have control over its contraction. Smooth muscle cells are most numerous in elastic and muscular arteries, and they exert what's called active tension in these vessels when they're contracting. So you can see that with elastic fibers, we had passive tension, and with the smooth muscle cells, we are able to create active tension involuntarily. So we have two different systems within the body that you're aware of, two main systems when it comes to the cardiovascular system, and that's the pulmonary system and the system. And the pulmonary system and the systemic circulation. And the pulmonary circulation is under lower pressure than the systemic circulation because blood does not need to be pushed as forcefully to go from the heart to the lungs as it does from the heart to the rest of the body. Now you can make notes of some of just a couple of the main concepts that I'm going to mention here, but for the most part we'll be covering a lot of this later. But one thing to make note of is the fact that the portal system is an area of the cardiovascular system through which we're going to have blood pass through two consecutive capillary beds before it ends up reaching back to the heart. So here's an example here, and this will come up a little bit later, but blood that enters venous, the venules here, so it's in the capillary region entering a venous area, but then as you can tell, instead of it going directly to larger veins that lead to the vena cava, instead it passes through at the level of the liver an additional capillary bed before it ends up into the vena cava. But as I said, we will talk about the reason for that happening. You can see that it's the blood vessels that are part of the digestive tract that once food is absorbed, it will return to the liver circulation before it ends up returning to the vena cava. Okay, here we're going to introduce a couple of other concepts. First of all, end arteries. End arteries are arteries that eventually diverge into a capillary. Okay, so an end artery will end up becoming a capillary. Arterial anastomosis. This involves the merger of one artery directly into another artery. So one artery to another artery. And this may develop sometimes in response to certain diseases. For instance, such anastomoses may permit bypass of a partially blocked artery by allowing blood to reach. So if there's a blocked artery where blood cannot reach tissue, we can have an anastomosis form so that blood is able to reach that tissue and give it sufficient supply. So sometimes these arterial anastomoses where one artery merges with another artery may be in response to certain diseases. And then the arteriovenous anastomoses, or sometimes they're referred to as shunts. These occur when blood flows from an artery directly into a vein without passing through a capillary bed. So normally we have an artery, passes through a capillary bed, and then turns into an artery to an arterial, capillary bed to a venule, and back into a vein and up towards the vena cava. But with a shunt, this occurs when we're bypassing the capillary bed and we're going directly from directly from an artery to a vein. An example of this, let's say somebody has hypothermia and we want to avoid further heat loss from their body. Our body will avoid this heat loss by shunting blood from the skin arteries directly to the veins instead of having to go through the capillary bed, because once it reaches the capillary bed, then even further heat loss would occur. So this is an example of a shunting mechanism. Okay, on this slide, this slide shows you the principal arteries of the body. So the arteries that are bringing oxygenated, nutrient-rich blood to the body, to the tissues to supply them. You don't need to know all of these, but I will highlight the main ones on subsequent slides, and I'll do the same thing for veins, and the ones that are highlighted you're expected to know. Okay, in this diagram here you can see if you can try to visualize, we have, so the heart would be here, we have the aortic arch. And if you remember from in class, we talked about the aortic arch and how there are specific branches that come off the aortic arch. You can see here the right and left coronary arteries, and these supply the heart with oxygen-rich blood as well as nutrients. Arteries that head upwards are generally supplying upwards, and those that head downwards are supplying downwards relative to the heart. You can see that the aorta here becomes the thoracic aorta in this region, okay, in our thoracic region. And then once we approach the diaphragm, so the diaphragm here, which is very important in breathing, once it passes through the diaphragm, the aortic arch, the aorta, which became the thoracic aorta, is now referred to as the abdominal aorta once it passes through the diaphragm. And a couple of important ones for you to be aware of are the superior phrenic artery as well as the inferior phrenic artery. These arteries are important because they supply the muscle of the diaphragm, which, as I said, is important with breathing, and they sort of work alongside the phrenic nerve, which also supplies the diaphragm, a very important nerve. We will be coming back to some of these main branches here that we introduced in our last class. We'll bring that up. I think it's on the next slide. But before we officially move on to talking about these, I'm just going to remind you of the main three arteries that do come off the aortic arch. So we have the brachiocephalic artery here. We have the left common carotid artery and the left subclavian artery. You should also note then that the brachiocephalic artery branches off into the subclavian artery as the right subclavian artery and the right common carotid artery. So it's important that you know that these originate off the brachiocephalic trunk rather than off the aorta or the aortic arch itself. And then these head upwards towards the head and the neck, which we'll see on the next slide. Okay, as we continue on now, you can see that here we have the brachiocephalic artery, so this would be coming right off the heart down here, and it branches off into the right subclavian artery, which travels towards the shoulder, and you can see the right common carotid artery progressing upwards towards the neck. And as we continue to move up, it branches. You can see here the external, so let's go back. We have the right common carotid artery, which as we move up, you can see branches off into an external carotid artery and an internal carotid artery, which continue to head upwards towards the head. Another important artery here called the vertebral artery is, as you can see, passing through a foramen alongside the vertebral column, which passes upward toward the head as well. You can see that if you look at this diagram here, of course this one here is showing you just the bones, but what we're not seeing is the arterial supply throughout the brain. You don't need to know this, but as you can see, there is substantial blood supply to the brain. Okay, now on to the major arteries of the upper extremity. The ones that you need to be aware of. So first of all, you can see again here the brachiocephalic artery, and you can see the subclavian artery. And the subclavian artery, it splits off the brachiocephalic artery and ends up traveling across the shoulder. And once it reaches around the level of the upper arm or the axilla region or the armpit region, it changes its name to the axillary artery. So the axilla area, sometimes you'll hear that referred to as the armpit. And then once in the upper arm, as we travel down, you can see that it splits into two other arteries called the brachial artery and we'll start with the deep brachial artery and the brachial artery. And these are supplying, for examples, the muscles of the upper limb. And then once we pass the elbow and we head into the forearm, you can see that the brachial artery is going to further split into the radial artery and the ulnar artery, which kind of mirror or follow alongside the bones, the radial bone as well as the ulnar bone. The radial artery here is what allows you to feel your pulse. If you were ever to feel your pulse or have someone to check your pulse, they're usually checking it from the radial artery. Lastly, we have, and we'll see this is the same in the lower extremities for the arterial system and the venous system, is that once the arteries come into the hand, they're referred to as the digital arteries, and that's just because they're supplying the digits or the fingers. And now we have the major arteries of the lower extremity. This image is showing you an anterior view of the right hip as well as the leg. And I mentioned earlier that once past the diaphragm, the aorta was called the abdominal aorta, which you can see here. And at the level of the pelvis, or at the level of the iliac crest here, it splits into and changes its name to the common iliac artery. Okay, the right and left common iliac artery. And at the level of the femur, so once we progress through down towards the femur, you can see that it changes its name to the femoral artery, which is quite fitting because it runs alongside the femur. And then once we get past the knee, and you can see there is a network of arteries through here, which you don't have to be aware of, but once we get past the knee, the femoral artery is going to branch into three main branches. So the first one that we're going to see is the anterior tibial artery through here. And you're going to see the fibular artery here and the posterior tibial artery. And they do follow alongside the corresponding bone of the same name, so fibula and tibia. And the other thing that you should make note of is that once we get down into the foot, it's the same thing as the hand, then we end up with digital arteries that supply the digits of the foot, or the digits of the foot. Now we've talked about arteries, the principal arteries of the body. We'll now discuss the principal veins of the body. Veins are the ultimate extension of capillaries. They unite into vessels of increasing size as they go up throughout the body, so they start off as capillaries to venules and then to veins, to larger veins. The large veins of the cranial cavity are not called veins, but instead they're called dural sinuses. We'll look at it a little bit closer in a couple of slides, but these dural sinuses should not be confused with the sinuses of the skull that are air-filled. Veins communicate with each other in the same way that arteries do, but they do this through anastomoses, and it's interconnecting veins that allow for communication. So the important veins that you need to be aware of include the superior and inferior vena cava. So the heart would be in this location here, but it's removed for better visual. But you can see the superior vena cava right here, and you can see the inferior vena cava here, which allow for blood returning to the heart, specifically the right atrium, so that it can be pumped to the lungs. You should also be aware of the brachiocephalic veins. We also have brachiocephalic arteries, and a lot of times veins, the names of veins will be the same as arteries. It's not always true, but for a lot of cases it is. And you can see that with the superior vena cava, it would be blood from the upper region of the body and the shoulder region that would drain into the superior vena cava, and then blood from the lower region of the body that would drain into the inferior vena cava, both ending up, of course, at the right atrium of the heart. Okay, in this diagram, what I wanted to point out to you is a subclavian vein as well as a right brachiocephalic vein. So here's the right brachiocephalic vein and the subclavian vein here. And then as we progress upwards, you can see the jugular vein. So there's an internal and external component of the jugular vein, and this is where there's a difference between names of arteries and names of veins. The sort of arterial match to it, so to speak, to the jugular vein would be the carotid artery. So that's where there is a difference. So you should be aware of the carotid arteries and the jugular veins. And the jugular veins, both the internal and external, are going to drain both the head and the neck regions. Really briefly looking at the veins of the brain, we call these dural sinuses, as I mentioned before, and their purpose is to drain blood as well as CSF, or cerebral spinal fluid, from the brain and re-entering this fluid into our circulation. The venous sinuses are found within the dura mater, a layer of the brain, hence their name dural sinuses, or dural, referring to the location near the dura mater. Okay, let's look at some of the major veins of the upper extremity. This includes, I already mentioned it, but the subclavian vein here at the level of the shoulder. And then, of course, reminding you of the brachiocephalic vein, I was moving backwards there. But then once we get to the level of the armpit or the axilla region, then the vein turns into the axillary vein. And once we get into the humerus region, then the main vein is called the brachial vein. So it doesn't have the same name as the bone itself, but it's referred to as the brachial vein. This vein here, which isn't highlighted but you should be aware of, the basilic vein is commonly used to remove blood from the body. So if you have to get blood taken for sampling, or if blood is being added to the body, not always but commonly the basilic vein is used for that. And then once we pass the elbow and we enter into the forearm region, there are two main venous branches that include the ulnar vein running along the ulnar side and the radial vein running along the radial side. And then, as you would expect, we have the digital veins within the hands that drain the digits. So of course what these veins are doing is draining blood specifically from the area that they're associated with in order to take the waste products and carbon dioxide back to the heart so that they can be sent to the lungs for kind of cleaning up and reoxygenation. So onto major veins of the lower extremity now. You can see up here the inferior vena cava, and the inferior vena cava branches into the common iliac vein. And then the common iliac vein, once in the femoral region, so at the level of the femur, is going to be called the femoral vein. And then once we pass below the knee, similar to the arteries of the similar kind, we have the fibular vein, used to be called the peroneal vein. And then we also have the fibular vein along the fibular side, and then we also have the tibial vein. There's both an anterior and a posterior tibial vein, and then once again we have our digital veins draining blood from the feet. So I spoke to you already very briefly about the hepatic portal circulation at the beginning of the lecture, but what you need to know about it now in more detail is that veins from the spleen, stomach, pancreas, gallbladder, and intestines do not put their blood directly into the inferior vena cava as do veins from other organs and areas of the body. Instead, their blood is sent to the liver by means of a hepatic portal vein. Key here is all three of these words, hepatic portal vein, which is not the same thing as a hepatic vein. So once in the liver, the blood is going to actually mingle. So once we enter the liver, the blood is going to mingle with arterial blood that are found within the capillaries at this region. And eventually the blood is going to be drained from the liver by the hepatic veins, which we can see here, and enter into the inferior vena cava. So here's the hepatic portal vein that's going to be bringing deoxygenated blood, waste, and some waste products from the spleen, the stomach, the pancreas, the gallbladder, and then the intestines to the liver, at which time the liver is going to mingle with arterial blood and eventually be drained into the inferior vena cava by the hepatic veins. And that's where there's a difference between hepatic veins and hepatic portal vein. Now, you're probably wondering why this is, and one of the reasons that we have this sort of diversion from the usual is because after we've eaten food, if our blood glucose levels go up, which they will after we've eaten, then blood can go into the liver so that the liver can take some of that glucose and store it. Similarly, if somebody has not just eaten, then this venous blood can pick up some glucose from this area before returning to the heart. So that way we're not bringing too much glucose to the heart. Just say right after we've eaten a meal. Another advantage of this is to rid our body of toxic molecules. So if you've just had alcohol, we run it through the liver first, and that's why the liver can take quite a beating. The toxins from the alcohol can be partially removed or at least detoxified before the blood is then distributed to the rest of the body by means of the heart. Now we're on to a very different topic, discussing circulation in the body before birth, because it very necessarily differs from circulation after birth, and for one main reason. It's because the fetal blood is going to secure its oxygen and nutrients from the maternal blood instead of from their fetal lungs and digestive organs. So once you're born, we use our lungs and our digestive organs to receive nutrients and to allow for oxygen exchange, but when we're as a fetus, it doesn't happen this way. We depend on maternal blood. So in order for this to happen, we are in need of special adaptations to the fetal circulation. A couple of things to mention on this slide is the placenta. So the placenta consists of both fetal tissue and maternal tissue. So it's some tissue that's fetal, and then some tissue because of its attachment to the uterine wall from the mother. And you can see that it's attached to the wall here, and if we look up close, you can see that it's heavily vascularized, which allows for a proper exchange of nutrients. And the bulk of this exchange between the mother and the fetus occurs at this level throughout here, the chorionic villi. So the next couple of slides we're going to be talking about what happens, well, this slide actually, we're going to be talking about what happens in utero and the adaptations that have happened to a baby. So this here is the fetus and the placenta. And I'm going to be talking quite a bit on this slide, so you could either take notes or refer to your textbook if you need if you need some additional information. So if we look at the fetus itself, we can see that there are many special adaptations. First of all, let's look at the umbilical cord here. Umbilical cord here consists of an umbilical vein, one umbilical vein, as well as 2 umbilical arteries. That forms the umbilical cord. Before birth, so while the fetus is inside the uterus, the human circulatory system has several special features that adapt the body to life in the womb. And these features on this image are labeled in red, but it probably looks like it's labeled in pink. And some of these features include, of course, the placenta, the umbilical arteries, and the umbilical vein that I already spoke to you about. It also includes what's called a ductus venosus. It includes a foramen ovale, which is here. It includes a ductus arteriosus up at the top, which I'll talk about shortly. And you should know that the umbilical cord is made up of the umbilical arteries and the umbilical vein. And because the lungs are not used for diffusion in a fetus, other structures must do this instead. And the main structure that does this is the placenta. This is where diffusion occurs rather than at the level of the lungs. And you should also know that maternal and fetal circulation is separate, so you don't have direct mixing of maternal and fetal blood. Okay, now let's talk about the blood flow of the flow of blood throughout the fetus, so the fetal circulation. So first of all, I want you to make note here that we have a common iliac artery, and branching off of that are your umbilical arteries. If you can see these here. So your umbilical arteries are branches of the common iliac arteries, and they carry, if you follow the direction of the arrows, they carry fetal blood to the placenta to be oxygenated. So they're bringing blood to the placenta to be oxygenated. This is an exception where arteries and veins sort of mean different things than you usually think of. Similar to when we talked about pulmonary vein and pulmonary arteries, that's where there's a bit of an exception to the rule of what they carry in terms of oxygen or deoxygenated blood. And now looking at the umbilical vein here, the umbilical vein is going to return oxygenated blood from the placenta. So oxygenated blood from the placenta is going to travel through the umbilical vein. Actually travels, I didn't make note of this yet, but this is supposed to represent the umbilical cord, the umbilicus of the baby, or the belly button. And this blood travels for the most part up towards the ductus venosus right here. You're going to see that there is a branch to the liver, but very little blood does actually enter the liver. Most of it reaches the ductus venosus, which is a continuation of the umbilical vein. And it lies just alongside the undersurface of the liver. And you can see that it drains directly into the inferior vena cava. This is the inferior vena cava. And most blood, I already mentioned this, but just again, most of this blood is actually bypassing the liver, just that small amount that you can see here. Okay, the next thing to mention is the foramen ovale. This is an opening right here, which is might be a little difficult to see on this screen, but you can see a little opening here between the right and the left atrium. Okay, so the foramen ovale is an opening between the right and the left atrium. And when blood travels up into the right atrium, we want it to go right into the left atrium because we are trying to bypass the lungs, as we already talked about, because we're not getting that diffusion at the level of the fetal lungs. So blood is going to enter into the right atrium, and most of it is going to be sent through the foramen ovale right into the left atrium, and then into the left ventricle to be pumped upward and out, which we'll talk about shortly. But it isn't a perfect system. So sometimes what happens is blood is going to end up going right into the right ventricle, which in the normal human heart would then send blood to the lungs. So because it's still going along this pathway, we need a diversion, and the diversion that we have is the ductus arteriosus. And that's a small vessel. We're ductus arteriosus right here, and it's a small vessel that allows blood to detour the lungs and instead enter the fetal circulation. So the main point here is that the lungs are not being used. Or very little goes into the lungs, very little goes into the liver. So we have a method in the fetal anatomy and physiology to bypass this normal function. So again, I'll show you that when oxygenated blood enters the fetal circulation, it's going to pass upward towards the ductus venosus, which is then going to dump blood into the inferior vena cava, which goes into the right atrium. Hopefully, most of it passes through the foramen ovale into the left atrium, but some of it is going to end up inevitably into the right ventricle, which is then going to be pumped up and diverted via the ductus arteriosus to bypass the lungs and into the fetal circulation, so that the fetal circulation can get all the oxygenated blood and nutrients this way. You might be a little bit confused on why we're seeing purple colored vessels here, and the reason for that is because almost all fetal blood is actually a mixture of oxygenated and deoxygenated blood, and that's where the purple coloring rather than the red or blue comes from. All right, so I know you might want to review that slide a few times to make sure that you understand the concepts, because it's very different than how normal circulation occurs after birth, which we'll briefly look at now. So after birth and then within the first year of life, certain changes occur in our circulatory system to adapt the body to life outside the womb. So changes occur. We don't need these special modifications anymore. And then once the baby's born, there's this major shift in blood flow, as now all of a sudden the lungs and the heart are functioning as we know them to function. I'm going to mention now the changes that occur. So first of all, let's start down here. The umbilical cord, and as you know, the umbilical cord and placenta are no longer going to be part of the baby. The umbilical cord remains for a little bit. Within usually a couple of weeks, it dries up and falls off. But the umbilical arteries, which you can see here, they actually change and become umbilical ligaments that remain in the adult body. You can see up here the umbilical vein actually becomes the round ligament of the liver, supporting the liver. Another change is the ductus arteriosus right here. So that small vessel that diverts blood or bypasses the lungs in the fetus actually becomes a ligament called the ligamentum arteriosum. So it kind of degrades and hardens and becomes a ligament. Another change is the foramen ovale right here becomes the the fossa ovalis. So it's what it actually does is it closes off and forms almost like sort of like a scar in the area, so that it closes off so that blood now can move properly through the heart. We don't want blood moving back and forth between the right and left atrium. And just as a side note, there are some issues that can sometimes occur with all of these changes. And a more common example than, say, others is that the foramen ovale doesn't actually close off, or it doesn't close off entirely. And what what this does is it allows, as you would imagine, deoxygenated blood to pass from the right atrium directly into the left atrium, which is not good. So these type of situations, usually identified in infants, end up needing to be corrected through surgery. Okay, and on our last slide, onto a different note to wrap up the lecture, some normal cardiovascular changes can occur throughout the human body, and we oftentimes see this as a result of exercise, so it's considered normal. And some of the things that we'll see is a thicker myocardium, so the heart muscle itself gets bigger and thicker and stronger. Exercise has also been shown to increase the supply of blood vessels in skeletal muscle tissue. And if you remember, through the process of angiogenesis, we would form new vessels. So these are normal changes, but then that aren't disease related. But then once you get into adulthood and through later adulthood, some degenerative changes are seen in some people more than others. It's rather dependent on lifestyle and genetics, but you can see as we age that degenerative changes in the form of atherosclerotic plaques, a condition called atherosclerosis, is seen within arteries, which can cause complete blockage of an artery, or it can cause weakening of these critical arteries. And in extreme situations, this is just an example here, but in extreme situations, you could end up seeing necrotic tissue because the artery is blocked off completely, not allowing any oxygen to the area, and then the area ends up dying, and you can end up with what's called gangrene. So this is just one example of many. You can also get so much plaque forming in these arteries that supply the heart, and as you would expect, if you can't get blood to a particular area of the heart, then it can lead to heart symptoms, heart attack symptoms, or the symptoms that you'd see preceding a heart attack or a heart attack itself. And the last thing to mention is that with age, we can also observe degeneration within the heart valves. So remember those valves in the heart that we've talked about in our last class, as well as degenerative changes in the myocardial tissue. So the tissue, the cells start to degenerate. And what this does overall, as I'm sure you can imagine, is it reduces the pumping efficiency of the heart. So that is the end of this lecture, and please make sure that you have understood the slides that we have discussed in class prior to this lecture to help you understand this lecture even further. Thank you for listening.